My name is Sarah Evans, and I'm a pediatric environmental health scientist at the Icahn School of Medicine at Mount Sinai, where I help to translate research to action by counseling families and communities about creating safer environments for children. One topic that we get asked about frequently is whether playing on artificial turf surfaces is a risk to children's health. And there are three areas of potential concern when it comes to children's health on these surfaces: chemical and microplastic exposures, exposure to extreme heat, and increased risk of injuries compared to play on natural grass. So artificial turf fields are essentially a large plastic grass carpet. Most fields also have additional sublayers made of multiple layers of various types of plastics and rubbers, and the majority contain small granules of infill made from ground up used automobile tires. Studies have identified hundreds of chemicals in these plastic grass fields, which raises concerns that they may get into the bodies of children and athletes. Many of these chemicals have been linked to cancer or are known to harm the brain and reproductive system. Artificial turf is also a source of micro and nanoplastics, which have been linked to numerous health outcomes and are widespread environmental contaminants. We also know that all types of artificial turf fields, including those without infill or that use plant-based infills, get much hotter than natural grass. On sunny, warm days, temperatures on these surfaces can get dangerously hot, reaching upwards of 150 degrees. Children are at greatest risk for both chemical and heat exposures when playing on plastic grass. And this is because they're closer to the ground where chemicals settle, they put their hands in their mouths, they're less able to regulate their body temperature, and they breathe in more air pollutants than adults. And because the brain, lungs, and reproductive systems undergo rapid changes well into the teens and 20s, vulnerability to interference from environmental exposures persists during these periods. Lastly, studies find an increased risk of season-ending injuries of the foot, ankle, and knee, which has fueled outcry from professional athletes in support of natural grass fields. As an environmental health scientist and a parent to young soccer players, I fully recognize the importance of outdoor play, team sports, and physical activity. But I encourage communities to consider the evidence that demonstrates that natural grass fields are a feasible, safer, and healthier option to support the needs of youth athletes.